Good afternoon and welcome to the Rotary Club of Des Moines. I'm Matt Busick, your current president. We have 9 guests today who I'd like to have stand and be recognized. I'd like to begin with Rick Shabbat, former member of the Rotary Club of Des Moines and visiting from Wisconsin. Good to see you here, Rick. Brad Kruger, guest of past President Steve Wooten. You remember Brad was here a few weeks ago from Intuitive Surgical and had a fascinating presentation. Good to have you back. Megan Cruz is here as a special guest of our club. She's with Edmonds Elementary. You'll hear more from her in a minute. Chris Sackett from Brown Winnick has been in my pocket plenty. So we're happy to have you, Chris. It's good to see you, even though I know your fees are overextended. Kim Peters, Vice President of Donor Relations at the Outreach Program, is here as a guest of Kathy Cody. Did everybody see that? Welcome, Kim. Glad to have you here. Joyce Wheeler is both a pharmacist at Hy-Vee, a Waukee Rotarian, and of course, spouse of Todd Wheeler. Welcome, Joyce. And finally, we have 3 guests from Unity Point Foundation, Matt Lyons, Caleb Hegna, and Denny Linderbaum. If you could all say hello, everyone. Happy to have you here, and thanks for being here. We've had a busy month at the Rotary Club of Des Moines. Our warm coat drive was a success, I'm happy to report. We met our goal of purchasing 300 brand new winter coats for kids at Orchard Place, which is terrific. So, you yourself and 20 of you toured the cemetery at Glendale Cemetery, together with Ganesh last Thursday. Thank you, Ganesh, for doing that. I understand it was indeed full of fascinating times and fun times, so sorry to have missed that.
No dead moments.
Okay, but it's better thing. All right, if that wasn't enough, Deborah Peckham has set up a wonderful opportunity for us to tour the Des Moines Heritage Trust's first historic renovation project, the 1909 East Des Moines Union Depot. That depot is located in the East Village on East 5th Street, and I would really like it if you could make it. I know Deborah would too. Make sure that you sign up in advance if you're coming. You can do that either out at the desk or send Kitty an email. We're just trying to get a head count and make sure that we have adequate logistics for everyone who comes. And I keep hearing over and over again that we want more opportunities to get outside of our Thursday meeting, so these are opportunities and I hope you take advantage of them. Now, on to the show. Sue Woody from our Community Service Committee will have a quick reminder about a volunteer opportunity that's coming up next week. She'll be followed by Colleen and our special guest with a quick announcement. And then finally, and I want you to understand, Kitty is going to take the podium with a fun announcement, I think. So she will follow the 3 of them. And then we'll be heading into David with Bob. Bob is going to be introducing David. So thank you. Sue?
Thank you. Just a reminder that next week, right here in this very room, we're going to set up a table in the back. We've got a stuffing party for our Simple Steps. We'll be stuffing up to, we don't have to get them all done, but 1,300 bags that will go to every preschooler in the city of Des Moines. So hope to see you. Just stay for a half an hour, 45 minutes, whatever you can do. 20 minutes would be great. Join us to help us stuff these early literacy bags. Thank you so much.
Good afternoon. It's my pleasure to host Megan Cruz today. So she's the Success Program Case Manager at Edmonds Elementary. You all have flyers on your tables. This is a very special partnership. And what Megan has helped me prepare is just a short story of impact about the kind of families that are so in need of this support. So one of the recipients of a gift card this year will be a grandmother. Let's call her Alice. Her husband died suddenly at 54 years old. And they've financially always been in a pretty good place. They were doing okay, but this death, of course, greatly affected their financial stability. In addition to this, Alice's son had 3 children with his girlfriend, and sadly, both the son and the girlfriend spiraled into drug addiction and have been incarcerated. So this left 3 young boys under the age of 8 in the custody of the Department of Health and Human Services. Grandma Alice took them in, and she's raising them as a single mom on a single income. So your generosity will help Alice provide a warm and delicious meal to her grandsons. And this is just one of hundreds of stories that Megan could tell us. So I hope you'll join me. This is a tradition as part of my niece and nephew's Christmas present that we support a family. Maybe we'll do 2 this year. We'd love to support 150 families this year. So to participate, please sign up. You can look at the flyer on the table. You can have your Rotary account built. And our deadline is Wednesday, November 9th. Thank you very much.
Matt looks nervous. All right, so it's always fun to hear from you, where you've been over the weekend, or a trip you have coming up, or a trip you've recently been on, and we want to have some fun with that. You've heard of where in the world is Carmen Sandiego, or where's Waldo? Well, we have our own, where in the world is Matt? So, we want you to take Matt with you on an upcoming excursion and share a photo with us.
Oh, yeah.
So, we have 2 options. We have flat Matt, who fits very well into a suitcase or bag, or we have Matt on a stick, who also serves quite well if you're going into a tropical or a hot space. So, we take the photo, share it on your social media, or just specifically send it to me. And we will be sharing these before meetings on our scrolling PowerPoint and our newsletters and some other fun places to be determined. So, you have to check out Matt on a stick. So we have some rules. You have to check him out first. So we have 2 of the flat mats. We have 2 of the mats on a stick for a total of 4 right now. We can make more of those. And you'll check them out through the office. You can pick them up at a Thursday lunch meeting, or we can make arrangements to get them from my office on Fleur Drive. But then you do have to promise that you will return him. And while you are taking him, please remember that he is precious cargo. And as you can see, last week was his very first excursion to Glendale Cemetery. He wore his seatbelt, and then we have him in the photo with us at Glendale Cemetery. So now, if you lose him, you will be charged a very hefty fine to the Rotary Club of Des Moines Foundation. Now, the fine will be determined by Living Matt, depending on how and where you lose him. Now, I'm sure President Don Flannery of the Foundation Board would love those fines and some money to spend on our good projects we do for the community, but that is not a challenge, so you don't want to lose him. And last but not least, the photos must be rated PG, and abide by the four-way test. Okay, so that rule was really for Greg Edmonds, who isn't here today, but we're going to pretend it applies to all of us. So let's have some fun. Check Matt out on a stick or flat mat. Take it with you on an excursion. Take the photo, send the photo, and let's see where in the world is Matt. Thank you. Oh yes, and I'm supposed to lead the Pledge of Allegiance and the four-way test. So please stand.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And the four-way test.
Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned?
Now greet your friends and fellow Rotarians, and then Bob Reed will introduce us to the
Good job, Kitty. Now I gotta try to figure out how to count that off. How you doing, man? Kitty. Yes. Good to see you. Now you gotta get up and see twice. I am sorry. Normally you're getting all right. Got one? I look forward to it today. Thank you. How the heck are you?
Have our first taker.
Nicely done. You're just you're on a pedestal in our family. Just taking this back, brother. You're looking well. Looking forward to it.
How long is it going to go on? All year?
All year.
Doesn't get fun till the winter.
That's right.
Well, good afternoon, Rotarians. Today I have the pleasure of introducing the leader of Unity Point Health Des Moines, David Stark. David oversees the Iowa Methodist Medical Center, Iowa Lutheran Hospital, Methodist West, Blank Children's Hospital, and all of that also includes the John Stoddard Cancer Center, Taylor House Hospice, and Ireland Ball. So a little bit about David. David joined Unity Point back in 1996. He's a native of Iowan, and he received his undergraduate degree from Iowa State University. And he got his master's degree from the University of Iowa. David is a fellow at the American College of Healthcare Executives. He serves on the boards of the American Heart Association, Iowa Hospital Association, Greater Des Moines Partnership, Principal Charity Classic, Iowa Public Television, and is a member of the Des Moines AM Rotary Club. So, all that stuff's really impressive, but here's what I'm going to tell you on a personal note. In my almost 2 years at Unity Point, what's impressed me most about David and his leadership is that no matter how busy he is, he's quick with a genuine hello. He is probably one of the first people to go grab a patient who looks like they're missing or a family member and get them to the place they're supposed to be in the hospital, which, by the way, finding your way around a hospital is more difficult than the woods. But the other thing that also impresses me is that no matter what we ask him at the foundation, he does stuff on video, that is sometimes quite ridiculous, like being an Olympic announcer for the Compassion Olympics. Learning how to ride a bike on a bike with training wheels to announce Lance Armstrong as the speaker for the Rally Against Cancer. And the most recent one is his reprise of Will Ferrell as a Spartan cheerleader. Again, he does this on video. But David is willing to put us all onto Unity Point. But I'll tell you what impresses me the most is that David lives our focused values every day in both word and deed. And as a leader in a big organization like that, that impresses every one of us. It makes us work much, much harder to be good to our patients and also to our community. David?
Bob,
thanks for that wonderful introduction. I'm glad I didn't read it beforehand. I would have taken the video pieces out. And no, you're not going to get to see them today. But those are all true. Very nice of you, and it's great to have our foundation team here and so many familiar faces in the crowd. I'd be remiss if I didn't recognize one of our board members, John Schmidt, who's here. And John and I had a meeting this morning. And I made the comment to him, and I'll test this afterwards with you, John. I said, I want to present at least one thing today that you didn't know. So that's my challenge to him, and hopefully a very meaningful piece to all of you. It's really good to be at the club, a fellow Rotarian. Rotary runs in my family's blood. I'm a lifelong Iowan, originally from Fort Dodge. And my father was in the noon Rotary Club that met at 12:15. It was the noon club at 12:15. Like, okay, was the clock always there at the Elks Club? And they would have, once a year, you had to bring your child to Rotary. And I would get out of school and I'd be able to go there and have lunch, and I did that every year from kindergarten through senior year. My dad was a 50-year Rotarian. So what Rotary does, what you do, the coats, the support for the schools, the support in the community, and this club in particular, I say thank you because it makes a huge difference. And you like to have fun. So I'm contemplating that whole flat mat deal to take, maybe we'll take him to the OR, we might take him to endoscopy, maybe to the OB unit. We might have some fun with that, man. Kitty, I'll talk to you afterwards about that piece. So different than others. All right, I'm going to talk just a bit about Unity Point, but also what's contemporary issues that we're facing in healthcare. Things you've heard about, read about, and hopefully informative for you, and I'll leave some time at the end for questions on what's on your mind. Unity Point Health. Those of you that have been in the community for a while recognize Iowa Health System, maybe as the name. Unity Point's been our name, and we're still based here in the Des Moines community in 9 regions across 3 states. Here's the map with all the hospitals, clinics, home care, colleges, and so forth. About 32,000 team members in our organization across all this footprint. So that's the large organization that we are part of. More specifically to Des Moines, and you heard Bob talk about this and explain kind of what makes up Des Moines. The hospitals are kind of the obvious one, right? People recognize them, big facilities, been around a long time. So Iowa Methodist, Blank Children's, Iowa Lutheran, and so forth. But we're much more than that. And you think about Irely Ball, our community mental health center. That is formally part of us in 2019. Unity Point Clinic, all the different clinic locations you see throughout the community in rural communities. That's part of our regional drive. And then home care. That doesn't get a lot of recognition sometimes about all the services we provide literally in thousands of patients' homes every single day, including our hospice care and so forth. We also reach all the way out to Grinnell. They're part of us as well. So this gives you a picture of what we call Unity Point Health Des Moines. And the founding of the system happened right here in this community. The end of 1992 was when when Lutheran and Methodist and Blank came together. That was the beginning of then the Iowa Health System. And then added Cedar Rapids after that, but it started right here in Des Moines. And in fact, we celebrated yesterday, quote, our newest hospital, Methodist West. Yesterday was the 13-year anniversary of the first patient being treated there. So I think that, 13 years, it feels like it's been, in some respects, a lot longer and a lot shorter than that. So that makes up who we are. And here's just some statistics. I won't bore you with these, but gives you a sense of some of the numbers of physicians that we employ. Some of the ER visits, over 115,000, admissions and so forth. Just to give you a sense of kind of the statistics of who we are at Unity Point Health Des Moines. And so let's jump into the topics at hand. I don't know if you've heard or not, but the pandemic's over. Newsflash, it's over. And right, it's over. Well, I want to talk a little bit about COVID-19, and some of you have had to put up with my updates through the last 2.5 years at the partnership briefings and others. It's been a huge issue for us, a big issue in Des Moines, in the country, in the world, the last 2.5 years. In some respects, we are just feeling like we're getting back to normal, right? Gathering together for a meal, being able to go to your place of worship, and feel safe, the grocery store and so forth. The hospital has dealt with quite a bit, and we dealt with a lot in our community. That first number is something I'm proud of, but I'm also tired thinking about that number. We've had over 5,600 people admitted in the last 2.5 years just in our hospitals with COVID-19. Most of any place in the state, more than the university, more than anybody else. And so that has been draining. That's been a big deal on our team, and we'll talk about what impact that's had with staffing and with turnover and all of those kinds of things. It's a big issue. So to give you a sense of the most COVID admits we had in a day this year, we had 24 admitted in one day, and you see the high point and the low point. Those all happened within 90 days of each other. That's how quickly this changes. So we were at 131 on January 17th, and by April 15th, we're at 3. Today, we're at 32. That's the number we have this morning. So certainly not at the high point, but Iowa still is, quote, substantial transmission. Now here's a quiz for you. In the wisdom of the CDC, is substantial greater than high or less than high? Who wants to venture a guess? This is a legitimate question. Substantial or high, which one is greater? Is it high or is it substantial? What do you think?
High.
High is greater? Smart club. Absolutely. High is greater. Well, substantial is the one below that, and that's allowed us, we're now in substantial, which has allowed us to change a lot of our hospital policies. So if when you come in today, which we were probably the last ones to do this, you do not have to wear a mask when you come in the hospital. It's optional. We are not now testing you before you have a procedure for COVID or when you're admitted. That just changed within the past 2 weeks. So a lot of people said you were a little slow to the game on responding to this because others were doing that kind of thing. And my response was, we're a hospital. And so that's where sick people are. And our goal is to keep them healthy or get them healthy and keep our team members safe. But we also are changing some of those policies. And I'll make a final comment here, and I won't talk about the pandemic again. But something I am really proud of these last 2.5 years is how the healthcare facilities in this community work together. And I've been here, as you heard Bob say, I've been here 27 years. And so I've seen a lot of, we compete like crazy with Mercy One, no question. We compete with Broadlawns, we compete with fill in the blank, right? But I've never seen the level of cooperation in the last 2.5 years of how we shared resources, did things consistently, worked with the health department, did stand-up testing, you name it. We shared resources, we shared vaccines, back and forth. That's something I am very proud of, and that continues today. Do we still compete like crazy? You bet, and we should. That makes it better. That makes it better for our patients. But boy, there's things that we shouldn't, and this is one of them. And that's something I'm really proud of and want to convey to the group. I guess I do have one more slide on COVID-19, and then I promise I'll be done. This is the vaccination rate. So a lot of people ask me, how are things coming with the vaccines? What's it look like in the state? This is right off the state website as of October 3rd. So the darker the colors in the state, the higher the vaccination rate. So in Iowa, as of October 3rd, when you take all population, we're at 60% in the entire state of Iowa, fully vaccinated. Polk County is third best in the state, and the number there is 67.2. So Polk County has been, and our community has been leading that effort really since the beginning. We have always been ahead from a vaccination side of things. Why is that not higher? Well, two things. One, this is all population. So there are still children that aren't eligible. So that number comes out of this, right? And there's still plenty of folks that have not gotten it. So vaccination rates, we continue to harp on this. There's the bivalent booster. There's all those, continue to get vaccinated. Get those boosters. That's an important public health message I'm leaving you with today. All right, let's talk about some services and turn our attention to more enjoyable things. And I don't start this first bullet point without recognizing somebody in the room. Dr. Doug Dorner, former colleague of mine, a really close friend. Doug's leadership over the years have really set the stage for what we do here to train doctors. The medical education that we do in Des Moines and do specifically at Unity Point, a lot of people don't know about. But I want to brag on that just a bit. We have 7 residency programs today, 7 different ones with over 100 residents that are in our facilities today. And that's been true for almost 5 decades. We are a formal medical campus of the Carver College of Medicine from the University of Iowa. And so a strong partnership and relationship there. Why is that important? Why do I bring that up? Because that commitment is twofold. One, it helps to keep us sharp. Because having residents there focus on teaching new trends, new techniques, it keeps us sharp, and it's good. And we're training that next generation. But it's a heck of a recruiting tool as well. 60% of the residents that go through our program stay right here in Iowa upon graduation and practice, a lot of times for many, many years. One of the programs I want to point out is psychiatry. That's a new one, and I'll talk in a minute about some of the challenges we have, and it's nationwide, it's here, about mental health and access. We have a psychiatric shortage, and Iowa is ranked number 49 in psychiatrists per capita in the country. The wrong end of the ranking, frankly. And so 5 years ago, and I can't take a lot of credit for this, but our organization, and I helped to carry it along, said we need to do something about it. We're not going to solve it, but we need to do something about it. And we partnered with Broadlawns, and we started a psychiatry residency program. So we are training psychiatrists 4 per year. It's a 4-year program. And this past July, we graduated our first 4. 2 of those 4 stayed right here in Des Moines, and they're practicing today. And we have offers out to 2 of the 3rd-year class, or the 4th-year class for next year. That is making a difference. And that's an important piece that we said we're going to do that. We're going to make that investment. The next item, hospital at home. Those of you that remember Marcus Welby, it has that kind of theme to it. We started a service here through our home care where actually we're providing hospital services in your home. So you come to the emergency department, you have a certain condition, it might be COPD, could be congestive heart failure, or something else. And we have a physician that's based in the ER that does that assessment and says we can take care of you with our home care nurses, our therapists, oxygen, we can do it at home. And you are actually designated a hospital patient, but we're taking care of you at home. Now that's just gotten started this year. We've had about 60 patients we've done that with. And why is that important? Why do I bring that up? Because we have to think differently about how we care for our population and how we care for people. When you're in the hospital, and I'm there every day, it's not where you want to be. You get care there, you do not get rest. We're bugging you all the time, right? The alarm goes off, we're checking your blood pressure, food's checking, do you want to order a meal, and so forth. You're more comfortable in your home. And what we found, and we've been at this about 18 months, the readmission rate, so the likelihood that you will come back in and be readmitted is less than 5% with the patients that do hospital at home. Our overall rate is 10. It's half of that. And so this is something we're really proud of and we're doing here in Des Moines. Not everybody qualifies, but it's an important part of how we do care differently. Speaking of that, the next one, outpatient total joints. 10 years ago, if you'd have asked me, David, what do you see happening in clinical trends? What's going to change going forward? What do you think about if you had a total hip replacement or a total knee replacement or a total shoulder replacement? Do you think you'd ever go home the same day? I would have laughed at you. I said, no way. Really? No way. This year we're going to have 350 patients that have already had a total joint replacement that went home the same day. Same day. So you're in at 7 in the morning, you're home by about 2:30 in the afternoon. Now, is this for everybody? No, not everybody. But this is something that, because of the way we do anesthesia, because of the way of the surgical technique, and the pain management, it's remarkable that we're doing that, and we're going to see more of that happen, of keeping on that cutting edge of things. The last item here is our 2 things that we just started. We've just started in the last 6 to 8 weeks, and the pandemic taught us a lot. How do we quickly adapt? How do we provide services to meet people where they are? And we found that virtual visits, people like that. People love that. I don't have to sit in the waiting room. I don't want to sit in the waiting room. I don't want to have to wait. I've got a pretty minor thing. I'm coming home. I'm busy. What can I do? So the virtual urgent care is something that's on your phone, your tablet, or your laptop, where we have 3 physicians from 8 a.m. to 8 p.m. through the week that are there that'll take your virtual visit. So you log in and it's like FaceTime. And you're on, and you have, let's say, you might have a rash. You're out working in the yard, you've got a rash. Can we show that to see if there's something there? Hey, could you look at my ankle? Could you look at my throat? Could you look at my ear, and so forth? And so that virtual visit is something that can be done and scheduled through the portal. And we're seeing about 16 or 17 patients a day, just getting started on that, but meeting people where they are. You don't need an ER visit for a lot of things. And the ER is an expensive place. It takes a long time, unfortunately, and it's inconvenient, right? If we can offer these kinds of things, it's even more convenient to get people the care they need where they need it. Same thing with the SMART exam. This one is really cutting edge. This is one where you don't interact with a physician. You fill out a questionnaire. So same thing, you're online, you get asked these 6 or 7 questions, sore throat, runny nose, I've got this piece, and within an hour, one of our physicians will review that chart, and if they deem you need a medication or if you need to be seen, they'll get back to you and respond. You never actually talk to somebody. We'll see how this one goes, but the point is we're trying different things, and we're trying innovative things to get care accessible to where people need it and where they need it the most economical. 3 other things I'll point out that we've started in the last year in our at Methodist campus on the upper left. We started an emergency department for OB. OB is obstetrics. So we have, that's basically an emergency department. When a new mom comes in, might be in precipitous labor, could have some other challenges with her baby or babies, rule out strips. We used to do that in the ER, which was on the other side of campus. We now have a 24-hour OB/ED just for new moms. And we're seeing about 14 patients a day there. It's safer. It's closer to the OB unit and all the services, and we got that started actually through the pandemic. One of the care models we also changed is Express Care. We have 3 of those. That's the upper right one. That's the sign in front of the Ankeny site, where that is you don't need an appointment, and it's different than the emergency department where you come in, and our goal is to have you in and out in 20 minutes. So it's for minor things, but we have 3 of those, and we're seeing between 40 and 60 patients a day. And so that has been proven to be very effective too, particularly for families with kids. Coming home from a practice or after school, and it's open till 8 o'clock every day of the week. And then our residency program, and I did this one specifically for Dr. Dorner. We've taken our residency program and expanded that. So our family medicine program that's based at Lutheran now actually has a second site in Waterloo. So we're training physicians, family medicine physicians, in Waterloo, the same that we're training them in Des Moines. So they have the same didactics, the same clinicals, and the same focus there that we can provide access in other parts of the state, which we're really proud of. Okay, challenges. This is the not so fun slide of what's happening right now in the industry. Labor, everybody knows it. Every industry's feeling it. Doesn't matter what you're in. Hospitality, retail, manufacturing, healthcare, HR, logistics, not-for-profit. Doesn't matter. We're no different. We currently, if you go out to the workforce site, we have about 750 jobs open today. So if you know anybody, we'd love to take the referrals. That is higher than average. We have about 6,000 team members, to give you a sense. We've seen a tremendous resignation, particularly on the nursing side, with nurses retiring, leaving the workforce. COVID was very trying on many folks, on everybody, frankly, and particularly in our profession. So that is a huge challenge for us. We are in a nursing shortage situation. Not that we haven't had that in the past. There's been multiple examples of that over the years. It's probably a little worse now than it is there. Workplace violence is contributing to that first one. And this is an uncomfortable one to talk about. But what I've seen in this past year or two is a level of incivility that I haven't seen before. And I think about that frontline nurse. We were 6 months into the pandemic, 7 months in, we had parades, right? We were ringing bells at 8 o'clock at night. Kids were doing sidewalk chalk. Nurses are our heroes. And now, up until the last couple of weeks, you had to wear a mask. We limited you on visitors. And now you became the villain. The staff became the villain. And the reaction of, I can't believe you're making me do this, verbal and physical violence is as high as I've ever seen it. we had a meeting a week ago with the Des Moines Police Commissioner, and he said your public safety team members said you have more altercations on a given day in your hospital than our Des Moines police officers do on the streets. That was chilling. That was chilling. And it's not just a mental health piece, and I'll talk about that next, but it's not just about that. It's a general incivility, and I don't know how to change that narrative other than recognize it, talk about it, and we've made a very clear intention to our team members that workplace violence is not okay. It's not okay. We've got your back. Mental health, I referenced that before. We can't talk enough about this. There are access issues, parity issues. It still is uncomfortable in a lot of arenas to talk about that. And you know, we treat it differently, but it is very real. And it's probably had even greater impact since the pandemic on many folks. And so one of the things that we have done through our partnership and relationship with Irely Ball, we started a behavioral health urgent care center. Never had that before, right across the street from Lutheran. And we're seeing close to 25 patients a day that are coming in there, no appointment, and in various stages of where they're at in their healthcare journey. That's helped keep patients out of the emergency department. Only 5% of those patients in that behavioral health urgent care end up in the Lutheran ED. And that's remarkable. But we have to do more. We have to do more as a society, and access is still woefully inadequate. Financials. This is a sobering number too. This is a Kaufman Hall study that they're projecting 55% of hospitals in the country will lose money this year. 55%, nearing 60. That's the worst I've seen it. And a lot of that's the labor challenge, right? With what we've had to do with temporary staff, the supply shortages, the inflation, and the general business. It's changed quite a bit. So we are no different. We are challenged with that economically. We've been around a long time. We will get through that. But it is a huge headwind for us. And then I'm not going to take credit for coining this term, but I'm also not want to spread fear, but there's a possible triple-demic. What do I mean by that coming up this fall? Well, what we're seeing today already, and I'd say the last 6 weeks, we've seen RSV, which is a respiratory virus, predominantly in kids. It's as high as it's been in 6 years in Des Moines. So just to give you a statistic of that, this week we have seen on average about 120 patients per day in our blank emergency department. To put it in context, we typically see about 70. And there are a lot of RSV, and this is happening across the country. So that's early. We usually see that in January, December and January, so that's early. Second, we're anticipating a fairly big flu season. We're seeing what's happened in the southern hemisphere last year or earlier this year, and we haven't had much of a flu season for 2 years. People have been away from each other. Well, that's going to be different. And then what are the variants going to do? These hidden variants, these evasive variants on COVID-19, the last 2 years in November, when we were at this date a year ago, so take October a year ago, we didn't even know Omicron existed. That puts it in perspective. It had not even been diagnosed in this date a year ago. And look what it did in November, December, and January. So all that said, the sky isn't falling, but there's a lot of challenges ahead. And it's even more important that we do what we do to take care of our community's health and focus on that and focus on our team members' well-being to take care of that. Okay, last thing I'm going to end with, and then some time for questions. We have been on a DEI journey, diversity, equity, and inclusion, as many organizations have. This is our framework. I'm very proud of what we've done organizationally and the focus there when we talk about those 4 quadrants. When we talk about what we're doing with team members, critically important. We measure that. We measure our workforce as a percent of the community's percentage from a diversity standpoint. And we have made a 20% improvement from 2020 till now on the diversity in our workforce. That's the right thing to do in all respects. But boy, opportunity for recruiting and hiring, who we serve in the community, and obviously we have a lot of good paying jobs. It's a really good thing to do. But it helps us organizationally too, be stronger. And the community groups and the fact that you belong in our organization. We have historically always been very female driven. That's been largely nursing. but we're about 65% female in our organization. But that's historic. But I'm talking about the greater pieces of diversity, ethnic, inclusion, gender, and so forth. That's been a very important piece. We're getting better on the patients. Let's track how we're treating you. So one of the things that we are working on right now is the difference in mortality for an African American woman and a white woman when they deliver. What are the comorbid conditions? They are different. One, we got to call that out. We do. So what do we do about that? And those clinical interventions we're going to make that different. That's where it comes to life in our community. That's part of the patient journey. And then our connections with the community. Our foundation does a great job raising money we have DEI scholarships. We have a number of things that we're focused specifically on people that want to advance in their career that we're going to fund, and the community supplies that support. And then our organization. What presence, what symbolism do we have? How does it feel different when you come to our organization? Do you feel like you're part of something? Because you may look different, you may talk different, you may be from a different place. But that's important for us, where you reside, and we meet you where you're at. So that's part of our DEI journey, and something we're very proud of. Our board has led that effort. I want to thank John in particular and our board for that. And it's really not just a single time thing, it's part of who we are. So let me end there. I think I'm doing okay on time. Matt, let me stop there and see if there's questions. Susan.
You mentioned that 55% of hospitals are losing money. And this is at a time when people are experiencing increased healthcare costs and insurance premiums are rising. What recommendations do you have besides all of us trying to be healthier?
Sure. So the question, I'll repeat it, with where we're at with the financial situation, co-pays are going up, the cost of insurance is going up. If everybody's going through their premium renewals now, you're probably feeling that. We are as an employer. What are some of the pieces I would advise you instead of just be healthier, right? Wash your hands, cough into your sleeve, don't go to work when you're sick, that kind of thing. I'd say there's a couple things that I'll say from a population standpoint. Then one thing I haven't talked about that we're focused on. So one of the pieces is active involvement in your health. And what I mean by that is not only, okay, you go to the dentist twice a year, right? Religiously, you get tackled before you walk out of there for that 6-month appointment, right? I mean, are you doing your annual physical? Because prevention is so important. It may not happen this year, but if you can get ahead of that and get ahead of hypertension and understand maybe you have some pre-diabetic symptoms and so forth. Can we change the diet? Can we change our exercise? Those are things that are under your control, but not taking control of your health and doing that, I think that's one of the most important things. And one of the things we have to do from a provider standpoint is provide that education of where the most cost-effective area to get your health care. So I'll tell you a little inside baseball. If you come to the hospital and get an MRI or a CT, it's going to cost about 40% more than if you went to Iowa Radiology in Clyde. Why is that? Well, hospitals have Byzantine rules. We have patients that stay in 2 nights, and we call them observation. They're not inpatients. That's true, but it was kind of meant to be a joke. Didn't quite land. Sorry, Matt. Sorry. But my point of that is, and it's hard, right? The transparency of even knowing that information, make sure that you're participating there too. So when you're in front of your physician, your nurse practitioner, and they say, you know what, I want to prescribe you this. Here's your first question. Is there a generic alternative? Are we really? Because that could mean the difference between a $5 copay and, depending on your plan, it might be a $70 copay. And you get the same treatment. So those are some things that I would say, that active participation. From our standpoint, we have got to be better clinically. That's our hallmark. We've got to get it right. When you come in, you expect that of us. We don't always do it. But we've got to get it right. The right medication, the right treatment. Make sure you don't get an infection. Because on that total knee replacement, if you have an infection, you come back in and we have to redo it, that's another $20,000 that we could have avoided. So there's a lot of waste in the system, and we got to be better at quality. So that's something we do. Yes, sir.
A question, since you brought up the money issue, my understanding is that the whole healthcare system is supposed to be more transparent with what the costs are up front, so the patient can actually understand But yet, I've read materials recently that indicate that Iowa health systems are not doing that. And I'm not saying just yours, I'm saying across the board.
We're on that list.
Yeah.
Yep.
And so, what are you gonna do about that?
Yeah, so the question is, as long as I brought up finances, what about transparency? And you're specifically talking about pricing transparency, which is a federal law, and there's a requirement that you're supposed to post your average reimbursement for your top 300 procedures. So that could be a delivery, MRI, you know, whatever, right? And so you post it in a machine-readable file on the website that's searchable. We have met that criteria. Now, how easy is it to go in and actually find it? I tell you, I know this stuff, it's hard. So how practical is that? That's the challenge. When you come in for an endoscopy, and that's one of the most common things, right? We will now call you a week in advance, assuming it's scheduled, and we'll give you an estimate based on your insurance. That's where the challenge comes in partly, is you have a Blue Cross, a well-marked PPO plan, somebody else comes in with an HMO with an HSA deductible, same procedure, much different out-of-pocket responsibility because of the plan. We put the average in there, and the difference of inpatient and outpatient, it's really challenging. And that's part of we have to own that as healthcare. I'm not avoiding the question, but part of that is the challenge of getting through all that insurance piece and everything else, which is really complicated. So that's a huge opportunity. Matt, standing up with maybe one more question or we're done?
We have to be done.
We're
I'm
done.
sorry.
Okay. All right, thanks, David.
So I do apologize. We do need to shut it down because I promised everybody we'd be done by 1. But if you do have further questions, are you willing to stick around for a couple of minutes? Great. Thank you, David, for spending time with our club today. Your comments were fantastic. We appreciate your leadership in this community, and Unity Point is an extraordinary gem. We're thankful for having it, especially me. I don't know if you know this, but I spent about 3 months in Unity Point Yonkers rehab. It was going to be my Hotel California. I was worried, but I did get checked out, so that's all good. In recognition of the time that you donated to us today, we're going to donate a book to the Rotary Rosie Reader Van Collection. This is a traveling library that we donated $40,000 to the library so they could purchase a few years ago. So one of the books there will be yours.
Good.
Thank you for your time. Okay, moving on to upcoming meetings. Next week, we will hear from Lauren Koloff. She's going to talk about what's going on the avenues of Grand and Ingersoll. And I think all of us wonder what's going on there, so please come back. November 10th, we are going to be meeting off-site. We are going to conduct our Veterans Day program at Camp Dodge this year. So make sure you look for details on that, and please join us there if you can. Last, on November 17th, we will be hearing from Dr. Tamara Badadam. She has recently been in Poland assisting with refugees from Ukraine, so I think that will be a really interesting program as well. As always, think about who you might want to invite. This is one of the best attributes of our club, and I'd love to have you bring guests. Now, Sean Mullen, please stand. Sean's birthday was yesterday. We can't sing as well as him, but we can on the count of wait. We can at the count of 3 wish him happy birthday. 1, 2, 3. Happy birthday, Sean! All right, thank you for being with us today. Thank you for.
Saltzgaber's birthday today.
Is it really?
Yeah.
Saltzgaber, stand up, stand up, stand up. All right, ready? 1, 2, 3. Happy birthday, Doug! How in the world did that skip off of our?
I thought your birthday was yesterday.
It was.
It was
Steve
yesterday.
Oh, all right, that's a foundation contribution for you. Speaking of foundation contributions, I hope you have fun on Halloween. I hope you have fun with my flat face. Put it somewhere fun. I'm thinking a scarecrow. In the front of a scarecrow might be a good idea because it's pretty ugly. Anyway, we're happy to have you here, and thank you for being here. We are adjourned.